We're going to get started. If you could take your seats, that would be wonderful. Yeah, I would do that. We're going to try to get started. If you could take your seats. We've got a very active program for the next hour and a half, so we want to make sure we give it its to be able to, and the panelists to be able to get into a very rich topic, which I over the lunch in the plenary session. So let me start by just introducing myself. I'm Eric Belsky. I'm the director of the Division of Consumer and Community Affairs at the Board of Governors. And I want to add my welcome to those of my colleagues in the Federal Reserve Bank of Philadelphia, and on behalf of the Board of Governors. It's an honor to be here at the what is clearly an outstanding conference that a remarkable amount of thought went into structuring, and was remarkably lucky and successful in terms of the audience it was able, and the quality, depth, and breadth of the speakers and panelists that it's the next couple of days. I want to applaud my colleagues here at the Federal Reserve Bank of Philadelphia, especially Deborah Hayes and Teresa Singleton, for their work on this conference and with their teams. A lot of people to achieve, and I want to thank all of those people for bringing this before the room, for spending your most precious resource with us, which is your time. You realize how that is your most precious resource, and how you spend it speaks a lot about what you think is important. So our goal is to make sure that you get a return on that investment, and I'm quite sure you're going to be spending time listening to the presentations that you're going to hear. The Board for Community Development and Community Engagement and Community Reinvestment, very broadly, our goal is to promote what works in community development and community investment. This has to do with our statutory mandate to both implement the Community Reinvestment Act and around the Community Reinvestment Act, as well as our broader interest as a central bank in understanding credit conditions, economic conditions, financial conditions, credit access, things like that, in communities in the United States. So how do we actually work to promote development, community investment? I'll just highlight four things, although there's probably more I could mention. We build stakeholders to understand how they see community needs and financing opportunities in reserve banks. So every reserve bank has a community affairs officer. Philadelphia's, but each of them is out there doing a lot to try to reach out to a wide variety of groups in an effort to understand these very fundamental things that are important to the Community Reinvestment Act, who live in these communities. So that's important, and I think we do a very good job in each of those districts and how they vary across those districts. We conduct research, then practice in the community affairs function and the community development functions across the reserve banks. We tend to focus on policy and practice, and this conference is wonderful in this regard because, as Teresa said, it's about communities and what do we know about approaches and efforts that have been attempted before. And that's just a wonderful place for us to be and an important role for us to play, and plays very well into the Federal Reserve System's capabilities, has access to data and information that may be difficult for others to get. We can reserve bank districts, the reserve banks do, to explore how to put knowledge into action to help those stakeholders who are getting together think about how they can get together and actually work on these community needs and make it important to the work that we do. And we've seen great success in doing that. When you bring people together and you help start a conversation and you supply information to it, good things can happen. And we help meet the credit and basic banking services needs of their communities. That ties most directly to the Community Reinvestment Act. The plenary session we're here now to hear is and the role they can play to spur positive neighborhood and community change. And what we're seeing, and I was talking to John just before I came on the stage, is an increasing number of universities and hospitals forging new partnerships to try to make a difference in their communities. And like every other institution trying to make a difference in these communities, it has its challenges. And I think develop more of an understanding understanding and appreciation that as more and more of these anchor institutions realize this is something that's important to their mission, they have information, they have approaches, they have people they can talk to, and I think that's exactly where we are and where we're headed. We have 3 individuals that are really uniquely suited to bring these matters both to life, and I'll talk about that in a second, and to shed light and insight into them. So their bios are in your package. Introduce them to, I guess you're lined up in the order that you'll be. Kathy Eden, who is the Bloomberg Distinguished Professor of Sociology at Johns Hopkins University, researcher, and someone from whom I personally have learned a great deal through her writing that she gave while we were both at Harvard. She was someone that you really wanted to listen to because she gave you really a context for understanding the work that we're doing. It's really a treat. John A. Fry is the president of Drexel University, also a remarkable individual, and he brings to this role his previous experience as EVP, Executive Vice President at the University of Pennsylvania, where he built a coalition of local stakeholders to support a multi-pronged strategy to address key neighborhood. And in reflecting on that, when we were speaking a moment, not only for the community, but for the university to be a part of those kinds of efforts as a partner to those that live around the university. This is Tyler Norris. He's the Vice President of Total Health Partnerships at Kaiser Permanente, where he heads up the anchor institutions strategies. And I noticed in his bio it was put in quotes, but we can take the quotes off. That in someone's bio for a system as large as Kaiser Permanente is already sending a pretty powerful message about the realization that these institutions are anchors and they can play a productive and sustainable communities movement, and has founded, which I found interesting, more than a dozen businesses and social ventures. I don't think I applaud you for that amount of productivity. We're going to lead off by sharing her insights into what it means to live in low-income communities and how partners can create opportunities for residents and some of the challenges in reaching out in that way. Then you will hear from John and Tyler, a discussion among the panelists. So with that, let me turn to Kathy.
So I want to talk of instability, especially in low and moderate income neighborhoods across America, that I've written about in various books. I'll try to direct you to those books as we go along. Little known facts that have huge relevance for the work that we're all interested in doing in this room, and especially for those of us who are part of anchor institutions that are vitally engaged with our cities as we are at Johns Hopkins. The first little known fact, the first is at the family level. I sometimes joke, but I'm not really joking, and make this single mothers. There actually is data to back up that claim. If you look at a birth cohort study of so-called single mothers and follow them over time as the Fragile Families and Child and Wellbeing Study is done, what you see is that only 4% of children born to so-called single live in a stable single mother household continuously over the first 5 years of their lives. 80% experience some form of instability and complexity. So what's that? Instability occurs when parents break up and mom and dad take on new partners, and new children are born along the way, so that you have step siblings. And what we see at the bottom, in the bottom third of the income distribution in this country, marital status and education, income are very, very highly correlated in the United States. What you see is a highly complex and highly unstable that is historically unique. We've never seen it before in this country. Among rich nations, we are the only country in the world that exhibits these patterns. And finally, it's almost wholly now concentrated at the bottom of the income distribution, so that it affects many other factors. Beyond that, as we've argued in our book on single moms, written about moms here in Camden and Philadelphia, Promises I Can Keep, and our book on dads, Doing the Best I Can, in the bottom, families are more often formed by accident rather than design. Couples want to get it together for the sake of the baby, so once that child is born, there is a high rate of coupleness, for the sake of the child, but a very high rate of breakup by the time the child reaches 5 years old. Now, this instability and complexity is both a cause and a consequence of poverty and inequality, and the reason it matters is that though children are resilient, the rate of change in both the cast of characters on the parental and sibling level in children's lives, their ability to cope, and especially for young boys. So very high history and complexity, really concentrated in our low-income communities. In income, and this is really for two reasons. We argue in $2 a Day, a book I wrote about a year ago, that work has become more perilous for those at the bottom, those without a college degree, a high school degree. There's been a rise in those involuntarily employed part-time, a rise in the zero-hour contract. Employers are now using software, as you know, to precisely peg if the foot traffic shows an employee will be sent home with no compensation or told at that time. Two stories from from $2 a Day. One comes from Cleveland, Ray McCormick. Her little daughter Azara, she loves working at Kmart, but Kmart closes sides. She is going to make her future at the Super Walmart. She sets her sights on becoming cashier of the month, and her strategy is to memorize the barcodes of all of the produce, enter those in by hand. So she keeps a notepad beside her register and writes down these barcodes. She then reads them into the recording device on her phone, and she plays the recording device on her phone continuously at night. Well, she just did the job, she says to us, and yet one day she gets into the truck she's sharing with sort of a cast of characters who are all living in this semi-abandoned house trying to get by. She's given her, someone else has driven all the gas up, and no one in the household has any money to fill that tank. And she calls her manager. By the way, she does get named Cashier of the Month twice in her first 6 months at the Super Walmart. Have a reliable way to get to work. Don't bother coming in anymore. So we have perilous work, but we also have a safety net in shreds. Now, like when they fall. Third, neighborhood instability. Now, Americans have become addicted to the notion, or maybe because of the work of ethnographers like me, who knows, that communities are stable roots and social ties. This is not consistent with the data. There is much churn. Families are much more likely to churn residentially than other folks. The poorer you are, the more churning you experience. Across Philadelphia, Baltimore, Chicago, Cleveland, Dallas, all of the places we've worked, say to we live in here, meaning that they have withdrawn intentionally. The neighborhood is not their, is their castle, and they're actively withdrawing from the community by trying to make their houses, really rejecting that larger community outside. And we see this work, Stephanie, in at very high levels among low-income families. So what has happened is that churning has undermined community, and neighborhoods are no longer communities, particularly at the low end of the income distribution. So what we have rising rents. We also have falling renter incomes. This is the affordable housing crisis so poignantly depicted. But the churning in our low-income neighborhoods makes placemaking a real challenge. So your effects are going to be diluted, but perhaps most importantly, the folks you affect are likely to move. Now, it's hard to know what to do with all of this instability, and I want to talk about a fourth at the institutional level, which is probably the least talked about of these sources of instability. Many of these communities, especially if they were once working class, had a rich network of institutions that knit citizens together and created social cohesion. This is a social science word. I love the phrase social cohesion because it's like the secret sauce. It is the glue that is key to any thriving democracy because it is what knits us together. But our neighborhoods has also become more stable as institutions like the Police Athletic League, Catholic schools, very big story here in Philadelphia, the decline of Catholic schools and the impact on working class neighborhoods. We've lost this sense of social cohesion, so people began to say, we don't live outside, we live in here. So what do we do about this challenge? I would, I have a little soapbox here, so I'm going to use it. When we think about anchors, and anchors like the one I'm a part of, where should we be investing our dollars? And I would suggest that anchors the institutional lives of neighborhoods. In our latest book, Coming of Age in the Other America, which will be available along with $2 a day out at the book table, and I'll be there to sign them, we find that youth who connect to neighborhood institutions that give them a chance to form a sense of meaning and identity, what we call identity projects, are much more likely to succeed than youth that don't. I had a fascinating experience last year after the unrest, and we got a grant from the Casey Foundation to go out and talk to young people to get their story of what they thought was underneath the unrest and their views of the events. So we interviewed 60 kids, most of them in West Baltimore, and had a fascinating time with them. And I was stunned by the frequency with which these young people, unsolicited, brought up recreation centers. I'm like, okay, we've had this event in Baltimore. There is so much wrong with these communities. We invented redlining in Baltimore. It's a wonderfully hopeful place, but recreation centers? So more than anything else, what these young people said is that the police were one thing, but they felt institutionally abandoned by their city and gave example after example of how the withdrawal of institutional support, places to be, develop a sense of who they were what they thought was deep frustration and the unrest we saw in Baltimore. So if we can figure out a way to do this, if anchors can begin to reinvest in the institutional life of neighborhoods, it's possible that by knitting citizens together, by getting people outside of the four walls of their homes and actually into the community, we might see great gains in social cohesion. And I think if we skip the step of building social cohesion in placemaking, as anchor institutions will be impeded. I'm also from the city who scored dead last on Raj Chetty and Nathan Hendren's intergenerational mobility index. We're 100th of the 100 largest cities in mobilities, and I can't help but wonder if community within our neighborhoods might be the key to spurring, to jump-starting intergenerational mobility. After all, intergenerational mobility is at the heart we have made to every immigrant that has come to our shores, and of course that includes probably all of us in the room, one generation or two back. So thank you. And I'm going to turn it over.
Thank you, Kathy. That was an incredibly incisive look at the problems that we face each and every day in our communities. So I say we are confronted with these same problems every day at Drexel University, and I mean just that. When you stand on our West Philadelphia campus, you're only blocks away from working kitchens or running water, and where even 2 jobs may not be enough to make ends meet if you're lucky enough to get the 2 jobs. That proximity to Drexel drives home for me the enormous contradictions that we live with. It's why some have likened Philadelphia as a tale of two cities. So very nearby, there's another world, this incredibly rich environment of University City, with universities and hospitals and research centers and entrepreneurs and incubators. There are 76,000 jobs in this one center of activity west of the river. But most of those jobs go to people who live somewhere else outside of 19104. So how do we respond? My starting point is that we, by the very nature of where we live and who we live with, must be all the more so because we are an educational institution and an education anchor devoted to preparing a workforce for the innovation economy. Fortunately, I think institutions like ours are uniquely positioned to activate change, and so this is the sort of tale of one place and what we've learned. We really do understand the contradiction that we face in developing a dynamic campus in the middle of a federal promise zones designated by President Obama about 3 years ago. And it is a contradiction. So we accept this responsibility to focus on both immediate economic opportunity and in the context of the long term. As we continue to develop our campus and the areas immediately surrounding it, we need to earnestly seek to we make and in every project that we launch. At Drexel, we aspire to an engaged university, and that is not by happenstance, and I can tell you that is not a slogan. We are really committed to using all of the resources that we are blessed with, our academic expertise, our students' energy and economic capacity in a coordinated strategy of partnership with our neighbors. And that should be. So in a moment, I'm going to talk a little bit about some of the enormous challenges that work actually poses to us. But first, I hope I can maybe start by lifting your spirits just a little bit. Because for me, our experience beyond our campus does offer significant hope. And then, of course, it has lifted the spirits of our university in terms of understanding the kind of good that we can actually do. That hope can be seen in Mantua and Powelton Village and the West Powelton neighborhoods immediately to the north and to the west of our campus. For us, a very, very special focus on by incredibly generous donors that allowed us to start something called the Dornsife Center for Neighborhood Partnerships. So this neighborhood hub is actually located almost a mile from our campus in Mantua. It's an old-fashioned in this place. It's where residents and families and Drexel students and faculty and staff work together, sometimes imperfectly, but nonetheless in a community that continues to evolve their lives, including a new program developed in partnership with Goodwill Industries and the Community College of Philadelphia that provides college courses and high school degree completion. We also offer classes on how to get on the internet, resume, and how to apply for a job. So in this past year, we've had 8,200 visits to just 2 communities held, and many of our neighbors are there day in and day out, and we're supporting them. Also at the healthy meals in our community kitchen, we have dance classes, we have a writer's workshop and a writer's house. We even give legal assistance for people in our neighborhood with tangled title via our. And then one of the really wonderful things that we do is we have monthly dinners, and people just come and have dinner once a month. It's usually the last Thursday of the month. The last one we had, 300 people attended, and they had picnic blankets spread out on the lawn, and neighbors having dinner, no program, no nothing. Students, faculty, neighbors, a big mishmash of people. It's very Asian in terms of what we're trying to accomplish. A lot of good stuff happens in those monthly dinners. One really exciting development was the opening a week ago last Tuesday of the Science Leadership Academy Middle School, Dornsife Center. We welcomed last Tuesday 95th graders. We'll be up to about 270 students by the fall of 18. This is basically a phase-in of a school that we're going to be developing at 36th and Market Street in conjunction with the School District of Philadelphia, which will be a university-assisted, STEAM-based K through 8 or pre-K through 8 school, which will hopefully open if we do all the right things by the fall of 19. So we're making a big bet on public education in old-fashioned neighborhood schools. This is in addition to the other work that we do to support education in other public schools like Morton McMichael and like the Powell School and also 19 child care centers and pre-K classrooms throughout West Philadelphia. So we've embraced that promise zone, all of it, and are seeking to invest in it. On Dornsife, we've developed job training programs, we've brought local businesses into our procurement systems, and engaged local union members in building out our campus. So anytime we have a project, we think 19104. What can we do for minority-owned businesses, West Philadelphia-based businesses, women-owned businesses, people who live in these neighborhoods? How can we gather them up with us to complete the work that we need to do? And so that's some of the things that we're doing that I feel like are moving in the right direction. Now, I want to sort of step back and ask you to sort of imagine we're hovering over at, say, skyscraper height and looking down on the 100 acres of property around 30th Street Station. It's sort of a big expanse right along the river. With regional and governmental and corporate partners, we announced last spring plans to develop a 14-acre parcel that we own into America's next great urban innovation district. It'll be called Schuylkill Yards. It's about a $3 billion project. It should generate a fair number of jobs, both construction and permanent, and it's of opportunity for driving employment and driving economic activity. So when it's completed, it'll be multi-use. It'll have a major public park, which will be actually the first project that we invest in, which will center it, and then all around it will be all this development. So from the same height, then look a little bit north, and we can also see the neighborhoods where jobs one day in Schuylkill Yards may actually well be out of reach, which is so contradictory because they're only like a half mile apart from each other, unless this anchor institution intervenes in helping remake the educational system. And that's what we need to promise zones. And we need to say those two things aren't different. Those two things actually should be joined together. And so that's why an anchor educational institution has to be focused on partnerships with the community, on education and job training, and on lending its time and energy and expertise as a problem solver to address the fundamental challenges facing communities like Mantua in West Philadelphia. So that leads right into a series of challenges. From my earliest days as president, the first is, what are the moral and practical obligations of an urban university like Drexel to its community? And we've had a big university conversation about that. Secondly, is Drexel University, in fact, a good neighbor? I didn't believe so at that point. Those questions, to a large extent, still really frame the hurdles that we face. And I see three upfront challenges for us and for other institutions that are truly, hopefully, realizing one day their possibilities as an anchor. First, we are fundamentally an institution of higher learning. We can never neglect our core mission of education. We have at our fingertips extraordinary resources, faculty who can solve or help solve the pressing problems in our communities, students who are so eager to be involved and to make a difference, staff who understand the importance of being committed partners in our business practices, in our planning, and through their volunteer efforts, and even our board of trustees, where we have a standing committee now focused on community partnerships, which challenges us to consider the implications of our campus's growth on our neighborhood. Those people need to be aligned and driven towards thinking about anchor institution as part of mission and not as something separate. Second, we have to accept that we'll encounter both distrust and skepticism on a regular basis to be a good partner. And as I indicated earlier, residents may fear their neighborhood is being taken over by our campus, and in some cases with good cause. They often hear the promise of jobs as hollow. They worry that their children's future may be no brighter after all this is done. So what's the answer to that? Well, I can tell you it takes years and really painful dialogue with your neighbors, listening and building together. Then it means doing a lot of the nuts and bolts work of partnering with people where they are for their goals and not necessarily ours. Universities are famous for being full of people with ideas for solutions in search of problems. We have to sort of get off our high horse and learn how to listen again and to think together as opposed to imposing ideas and solutions. Third challenge I see, and it's inseparable from the need to build trust, is its sustainability. So the idea that this is a one-year plan or a 5-year plan or a 10-year naive. You're either in and you're in forever, or don't even bother, because that's how skepticism is built. We need to be long-term generational partners with our neighbors in the quest to solve the deep and intractable and long-term problems facing these neighborhoods. So we're looking forward, and we are looking forward with anticipation to many complicated work, because the problems we see aren't easily solved, certainly not by one institution, even a university. Working together, sharing expertise and resources. So a big part of my job is to build that buy-in and that trust, not only with our neighbors, but within our institution, where I can tell you many, many people are really skeptical about this idea of anchor institutions. So you're not only selling, neighbors on the idea that, this time you mean it, but you're also trying to sell your constituencies internally that we're not actually diverting resources away from the institution to put it in the neighborhoods. That's not an intuitive thing for many, and so there's a lot of learning that needs to be done. So this is a long game, a truly long game, and if you lose, a lot of good people lose with you. The stakes are really high now in the work that we're doing, and I can see it. That's why Drexel has put a stake in the ground to be a partner with our community, to lend our resources to support economic development and inclusion for jobs now and to children in our neighborhoods. And some of those young children attend a school in Southwest Philadelphia where a principal named Brian Johnson, someone I've met, and is doing absolutely the very best that he can. But Johnson knows better than most, said recently, and I quote, "Our kids look out the window and see Center City in the distance. It looks like Oz. Many of their families have never been to Center City, so there's a lot of work to do." And he's exactly right. So I think our responsibility is to work collaboratively with others, both young and old, to bring closer and even within reach the economic promise of Center City and someday, hopefully, Schuylkill Yards and all that represents. And we are more than willing to join with our community partners to do this hard work. It's work that we're blessed to do and so privileged to be doing. So thank you. I look forward to our conversation, and Tyler is up.
That was excellent, John. Thank you. Beautiful. Kathy and John, thank you. What a beautiful context for my moment to speak, Kathy, because to the extent, and John really setting the stage for what it means to be a responsible anchor and how challenging. I want to start, though, with just a thought, because I was texting with my daughter during the break, and she's 23 in D.C. and is often a little provocative. She was reminding me that for the last 25 years, I've been working to improve the measurable health of communities. And the other day she came home with a report from the Institute of Medicine that said that after the previous century, where the United States experienced an increase in lifespan of almost 24 years, that many children born today will live 5 years less than their parents. Her comment wasn't so funny, but she asked, what have we been doing, right? So she's asking the question, as she should, is on our watch, with a $3 trillion annual spend, 18% of the GDP, we're going backward. What that's reminding us is that more health care does not buy you health. And that's really a key premise for why our anchor institution strategy and else is so important. I work with an organization called Kaiser Permanente, nonprofit, a couple 100,000 employees, and I bring this up so that you understand our model. We're both a health plan offering 1.5 million members, and we're a delivery system with a couple 100,000 employees, 20,000 physicians, 60,000 nurses, caring for our members. In other words, we are at risk for the health of 10.5 million people. And the work on the social determinants of health, which you probably all, that at best, we control 10 to 20% of the equation. So we're at risk for 100% of health, and access to health care is 10 to 20% of the equation. Most of it has to do with life, with the socioeconomic and political and cultural environments in our communities. Exactly what today, the social determinants of health are the same as the social determinants of equitable prosperity or education outcomes or what's upstream from a truly inclusive economy. It's just that at the end of the day, when that doesn't work out, really where it ends up, or worse, in the criminal justice system. So again, at risk for 100%, controlling 10 to 20% of what creates health. That changes the equation for why community development is so essential sector. Now, we're a little different than other providers. Many of the health providers in your community are still being reimbursed in a volume-based model. In other words, they don't want you to be sick, but the truth is they get paid for the volume of services and treatment offered. However, the Affordable Care Act is increasingly placing those providing global payments or shared risk arrangements, where increasingly, somewhat like us, they're going to get a block of population on Medicaid in our states, Maryland well down that track, and other states block amount of money and then provide care, where they start having the same incentive we do, which is to keep people healthy in the first place. And how do you in fact do that? So we're all sort of moving that way. Another little piece to help you understand spend go in the United States, 80% of that spend goes to treat chronic disease, obesity, hypertension, cancers, heart disease, etc. Are 4 modifiable risk factors that drive 80% of that. Eating healthy, moving more, alcohol and other substances. The leverage point for all of that is determined by place. It has been over-equipped, but it's worth saying yet again that one's zip code is a greater predictor of one's health status than one's genetic code. We're working in a community in Cleveland right now where a life expectancy is separated by 8 miles. And I'll tell you, in the community that I live in Oakland, that a mile away, the lifespan, according to public health data, is 15 years less. Place matters, and so everything we're talking about is upstream from what creates health in the first place. And when we look at, well, what are the determinants, we learn that from our community health needs assessments, which, like ours, and the analysis of our members' non-medical needs. In other words, we'll treat somebody for their hypertension or diabetes, and then we'll ask them, well, tell us a little bit about your housing or your transportation or food. And it turns out that most of what the physician is saying about those modifiable risk factors, their behavior change, has to do with their housing, with non-emergency transportation, access to food, economic mobility, education, et cetera, et cetera. So community development upstream from what creates health. So I'd like to sort of frame it this way, that there is a marketplace for health, and in the marketplace for health, health systems like ours are buyers, not producers. The producers of health are community development organizations and others who are actually addressing those upstream determinants that we in fact do. So as a buyer of health, working with producers of health in community development and the intermediaries like CDFIs and others who are playing that kind of a role, we're increasingly looking at different contracting with community-based organizations to meet those needs, all the ways to looking at social impact bonds and other pay-for-success kinds of models over time. Really important to look at in that way. So being at risk for what creates health and recognizing where the leverage points are, public-private partnerships to multi-sector partnerships to 2, 3, 4, 5-year grant strategies. I will tell you that having invested for decades in health improvement in schools, et cetera, that the 2, 3, 4, 5 behavior don't work. They don't. They do not create sustained behavior change in, let alone actually change disease rates. That's why my daughter's point is so well taken. We have not actually invested with enough reach, intensity, and duration, enough people with a strong enough intervention for a long enough period of time. We flip 2, 3, 4, 5-year grants and we think we've done something, when in fact it's almost malpractice, because the truth of it is, until we start investing in our communities like we invest in our children with hopefully, a 20, 25-year view, we are not going to have. That's what's so promising about Federal Reserve Bank and many of you actually having this conversation, because it's in ways that are beyond this kind of grant cycle that we know doesn't really deliver at the end of the day. And that beyond that kind of longer grant making is what's the impact of us as an anchor institution. So as a $62 billion organization, we do a couple $2 billion a year of charity care and coverage and grant making. Good for us. Our procurement is $16 billion, 8 times that. So right now we're investing firms, $1.7 million of purchasing from women and minority-owned firms. But talk about the difficult part is localizing that into the communities that we're serving. our payroll, you're the largest private employer in California, for example, we can do perhaps more by making sure there are workforce pipelines into the living wage jobs than we can through partnering with Johns Hopkins, Bon Secours, Under Armour, and others to actually make sure that we're working with high schools and community colleges, the same things that have been discussed in the previous panel, to make sure that we're creating those kinds of, in Baltimore, where we're putting a new medical office building, putting a new facility there and flipping some grants, and not going to address what happened to Freddie Gray and what's going on in those communities. So we know that, and that we have to invest very, very differently. We'll get a little bit more into a conversation about examples, but we have assessed, with the help of PricewaterhouseCoopers, the complete impact, economic, environmental, and social impact of absolutely everything we do, from our buildings to our environmental stewardship, green energy, to our procurement, to our hiring practices, to IT, to using our investment portfolio on Wall Street to bring those monies to Main Street, because we know that's actually what it's going to take. And in places like Oakland, we're partnering with the help of Emerald Cities and others. We're partnering in a 25-year commitment with the city, the county, the school communities to partner with our competitors, with the city, with the county, to make that kind of a commitment, because that's what it's going to take to measurably improve health, healthier people, potentially reduce demand on the healthcare delivery system, and in so doing, and increase affordability. Because at the end of the day, the healthcare spend in the country is crowding out the dollars that we need to be investing in what creates health in the first place. And until you're partnering with your healthcare, we're just going to keep cranking up that type of spend. And I hope we pick up on this, about this idea of, well, that's where the jobs are. I know communities that bank their jobs on, prisons. And I wouldn't guess the things that create health, yes, but more sick care services? Not sure about that for the long haul. So, looking forward to a dialogue about what really we can be doing and how we can be using our anchor strategies in partnership with competitors, other health systems, with universities, cities, counties, school districts, utilities, and others, to actually have enough dose, enough reach, intensity, and duration to measurably improve health, lower healthcare costs, and change the investments that are upstream from a strong third century in this country. Thank you.
So these chairs are very comfortable. If any of us, I feel like we need teddy bears and a big fireplace up here. Hopefully we won't get sleepy. So I want to pick up on what you said, Tyler, about jobs. At the cornerstone of all of the sources of instability that I described earlier is a crisis in adequate work opportunity for people with the least skills. What are practical ways that anchors, and any examples you could offer, it would be terrific, practical ways that anchors, who are often sort of in the knowledge economy, as is Drexel's case, or in the healthcare sector, can really serve the needs for the least educated in our communities?
First of all, just a really important affirmation that if you're looking at the greatest leverage points over improving health, it's education and income. Yeah. All right? Those are the leverage points for what create health. So what we're trying to do together to actually create what we call a potentiation pathway, where young people see the reason for staying in school, following through, going to school, getting the training they need for a living wage job, why that is so important, and why going to college and others actually has something on the other side of it's important. I'll come to some examples in a minute, but in the Oakland strategy I was describing right now, Oakland Promise, a partnership of the business leadership, city and county, is a commitment to every youth in Oakland that if you get all the way through high school and your family and scholarships and all that can't get you to college, but you're ready for that, we'll pay for you. Now that changes the conversation for a third and fourth grader about why they need to stay in there. So, economic opportunity. We know that if we're treating diabetes, hypertension, and we're talking about their social non-medical needs, housing, transportation, food, there are jobs in those arenas. So we know that those non-medical social needs are actually what is needed to help that person from coming back readmitted for the very thing that we're treating them for, because so we're increasingly contracting with producers of health in the form of purveyors of those services to actually grow their capacity to meet our members' needs so that they can, in fact, hire people into those producing jobs. And it's all the way from promotoras and health navigators and community health workers to actually growing out the healthy food system that would allow us to write food prescriptions for healthy, locally grown food from enterprises in the communities that could do that. That's in part what Denise and Emerald Cities is helping us do. So whether that's in transportation strategies or actually investing in affordable housing with support services, we're investing in those kinds of enterprises, which of course increase hiring, not to mention hiring in the health system.
So John, I first moved to the Philadelphia Camden area where I lived for 10 years in 1995, and I was actually stunned to hear you say that in University City there are now 76,000 jobs. You know, we used to think that the problem with employment in the poor was something about spatial mismatch, but here we have no spatial mismatch. So how is Drexel thinking about the problem of employment and, you know, breaking down the tale of two cities you described?
Well, I think I mentioned that having an extension center is a great asset because it allows us to convene with other partners who do things that we don't necessarily do, like offer GED degrees or, you know, the partnership that we have with Goodwill Industries and the Community College of Philadelphia. So we can sort of stage activities that provide pieces of that educational pipeline and make it possible for people to have free space and free support to do all the things that they need to do. And over time, I think it's also become a place where our neighbors are comfortable coming to. And so we're kind of brokering a lot of these relationships. In addition, I'm very interested in one of the things you mentioned about these sort of enabling civic organizations to be strong and gather people together. So you may remember back in 1997, we formed the University City District, which ostensibly is a business improvement district meant to provide services to keep neighborhoods, you know, sort of clean and safe. But the real thought behind that is that it was a collection of anchor institutions who all made voluntary contributions to provide these services, you know, to their neighbors. But the thought was that these anchor institutions actually don't know each other. They have really sort of very little in common except for the neighborhood that they share. And in many cases, there was a fair amount of mistrust even among them. And by forming the University City District and enabling us to collectively build some infrastructure, that spawned something recently called the West Philadelphia Skills Initiative. And so the West Philadelphia Skills Initiative is basically set up to train local people in West Philadelphia and identify job opportunities. Well, I happen to have a huge need for medical assistance in my College of Medicine and in the clinical practice. So we contracted with the West Philadelphia Skills Initiative. They identified a bunch of incredibly talented people who went through this program, and then we hired them. Because we have the demand, but instead of just sort of putting an advertisement out and whoever responds, we sort of directed the opportunity towards a group of people who we wanted to support, and we used one of these intermediary organizations to provide the services that we really couldn't provide. So we're always thinking about our sort of partnering role and our brokering role, and how can we bring various organizations together to build capacity to meet demand, and where possible, you know, sort of also support what we're trying to do.
You know, we're going to get to the collaboration and partnership in a minute, but I want to talk for a minute about the community. You mentioned Mantua, which is, you know, your next door neighbor, and what's striking to me, being in a similar situation at Hopkins, is how difficult it is to really partner with the community, and how easy it is to sort of let that be a veneer, right, where a couple of local people get identified by a university as the leaders, and those people are called upon over and over again without real engagement. So, Tyler, maybe you want to take a crack at you know, talking about how you struggle with this problem of moving beneath that veneer to really connect.
Right. It's a really important question. I mean, with the community health needs assessments, which all nonprofit hospitals do, you tend to come up with the data and then have a dialogue with the community about what are the priorities and how we're going to move forward. And there's a lot of that, you know, it's a mixed bag. Some places we're much better and some places we're not so good at that. I think the real question is to start to shift the community as a set of needs into the assets that community actually represent in the first place. So for example, in Central LA right now, working with ICIC, we're partnering with 100 women and minority-owned firms that are potential long-term vendors of us that are in the $1 to $2 to $3 million size to help build their capacity to be larger vendors with us. Now that's a really tangible way to partner with growing businesses that want to go to scale and actually take on the kind of contracts that we need. We're doing the same thing, for example, with the East Bay Asian Local Development Corporation in Oakland, a 30-year-old community development corporation, who is trying to increase affordable housing. But anytime a multi-unit building goes onto the market, the money boys and girls from San Francisco have bought a building before lunch, right? It was just cash. And so one of the things that we've done is with our investment capital, we've given them some dollars to be able to actually buy that building as well before the market rate folks actually come in. So I think that by localizing our spend and working with local businesses, working with housing organizations, working with the nonprofits that can provide support services around housing, we're actually in more of an authentic conversation with community organizations and people and residents of communities than actually just sort of, well, what do you think the data means and what do you think ought to be the priority? And at the end of the day, the bag is back on the organization and everybody's sort of gone. And I think that's a real shift that needs to be made to make that authentic rather than frankly, the veneer, which is, I think, a good choice of words.
John, you're in the poorest large city in the country. I'd be fascinated to hear how you've thought about engaging with your neighbors.
Well, I think the first thing is that we realized early on that there is no such thing as the community.
Right.
I mean, it's incredibly rich as you go out and you start to meet people from local parishes and churches and local businesses, that there are so many intersecting and overlapping, communities. And so, we're doing a health needs assessment, and this has become a really big and complicated project. And that's a really good thing, because I think we thought we'd just sort of knock off a bunch of focus groups and everything would be terrific. And as we started to ask people, actually, well, who are the leaders and where should we go? We've been on this sort of journey now. And we are meeting all sorts of people, influencers, who don't have official titles. They're not heads of civic associations or, wardens at churches or anything like that. I mean, they're all over the place. And so I think, and this is just a long journey, we're developing this, I think, finally, a nuanced understanding of, what the community means. And it's many communities, and no one speaks for everyone. And the self-appointed people are the ones you really sort of have to be careful of. Because, that in itself could be a sort of a political act on their part to sort of aggrandize, their own responsibilities. And so we've become very, I think we've become, as an institution, much more tuned into the grassroots. It takes a lot more time, but I think we just sort of do better. And I think we're actually picking up insights now into in this case of this health assessment. The health needs in this federal promise zone are very, very different as you go from, these 3 to 4 blocks to the sort of next little section. And it's complicated, but we're not approaching this monolithically anymore. We've gotten kind of past, that frame.
I love that answer. You mentioned goodwill. And both of you have talked about the importance of partnerships. But, these, and you mentioned actually mistrust as kind of endemic to this process, a skepticism and mistrust. But what about these local partners, and especially local partners who may have very little financial capacity, small nonprofits and so on? How does a big entity like a university or a healthcare system, intersect with Goodwill is a national organization, but also the local nonprofits who may have been working quietly behind the scenes for years trying to improve neighborhood conditions.
Humbly. It's really important. I think there's just an expectation that here comes the big know-it-all university. It's going to show up and tell everyone what to do. And I think we've really tried to recruit people to work with us who are really humble and know how complicated this work. And every time we go out, we're hopefully ears open and hearts open and willing to sort of learn and not be the solution looking for the problem. And I know that's not a particularly profound answer, but I've discovered over time that this just takes so much time and work. And yet, if you do that, things like what happened with the school and all the things that are happening, all of a sudden these opportunities start to spring up because people really do believe you're sincere about wanting to be their partners. And it's interesting, when we started this Dornsife Center, we had a sort of charter for it, and we had a lot of people from the university excited about it. It's such a different place than what we imagined it was going to be. Like this community dinner idea, it wasn't our idea. Some neighbor, whoever it was, said, well, why don't we all have dinner one night? And then 25 people came, and the next thing you know, we have hundreds of people come to. I don't even know who started that whole thing. But the various things that we're doing there are so different from what we thought, simply because we've we've encouraged our neighbors to be our co-authors of all these things. And it's leading us down all sorts of places that we never thought we would go to. And I think those have been good places.
So I was giving you high marks for social cohesion as you spoke, and I think that's a beautiful example. Tyler, talk about your partnerships.
Yeah, and really...
Maybe in particular, if there are turning points that come to mind in these partnerships.
I appreciate so much, John, what you just said about beginning with humility and authentic humility and really taking time to listen. And what it means to move from a transactional relationship around conversations to a transformational relationship that really has to do with what the community-based organizations are wanting. So, for example, in East Oakland, we have partnership with a number of churches, faith-based organizations that are essentially an extension of the community navigator strategy that we have. So we're caring for people that have hypertension and diabetes, and they need to change their eating and physical activity behavior, moderate their tobacco and others. And yet we can say that and encourage it and write the prescription for that, but it's a behavioral prescription, and we all know how hard it is to change behavior. So we're partnering with faith-based organizations to, in effect, support each other in changing lifestyle patterns, because that takes relationship and partner. You can't do that as a big institution. We need community-based organizations that are trusted and rooted to do that. So we've had process of discovery. Well, what would it mean for the Allen Baptist Temple to really be a partnership so that we treat you right, and what are you trying to do? And they're saying, well, it's the healing mission of our church to do this. So how do we really co-discover that? It's been the same thing with our procurement folks who are all day long. Their job is to get the best deal, right? Squeeze the vendor. And now they're out talking to thinking of Nona Lim, a small soup company with 15 employees in Oakland right now, about a little more expensive, but how could we begin to work with them and bring them into our supply chain? And that's a very different muscle of one of our procurement folks to actually, how could we bring you in, and what's the value of that? And we've seen that, even in the way that, I'll stop with it. But I think it's really one of listening, learning, and looking what is in it for them, that it would make it a true partnership, so that you sort of take this economic size business and start looking at that we need each other.
So I'm going to ask a little bit of a risky question here, and you can both pass on this, but I have found it true in my life that I often learn more from my failures than my successes. And in these issues of both community and nonprofit partnerships, has there been a failure / lesson learned that comes to mind that you think would be instructive?
In the rush to improve things and make things better, I think particularly at Penn, all of a sudden, next thing you know, gentrification is going on. And it's interesting, so many people are saying, oh, this is great, and we're looking and saying, we kind of inadvertently, I guess, caused this, and so what do we do? How do you backtrack off of that? And I think maybe it was early naivete in terms of how we approach things. I think now what we're trying to do is really work hard to sort of avoid that, to think about intentionally about affordable housing up front, the impact that our students have on the communities, the impact of speculative landlords. I mean, all those issues are being discussed. It's really painful, but at least we're doing it before it appears that this stuff is happening, although I know it must be happening right now. And so that's been a really complicated and emotional and difficult issue to deal with. And I know at Penn, you know, some people might think, well, look at all those parts of West Philadelphia that have been approved. People just got pushed out.
Yeah. So I remember in 1995, it wasn't that long ago, nobody thought West Philly had any chance of gentrifying. So kind of thinking ahead and putting the brakes in place, or ensuring that you have we had the mayor of Atlanta with us at Johns Hopkins last Thursday, and was describing what happened with what's going to be happening with the land that's going to be freed up when the Atlanta Braves move to the suburbs, and how they're intentionally telling homeowners who are there in the community, don't sell. You know, the work they're trying to do to keep the legacy residents in the neighborhood as redevelopment occurs. So I think that's a beautiful example. One of the things that I, as an ethnographer who spent time in communities, sort of come up against over and over again is, and particularly in my work with youth, is that many of the problems we see amongst our youth are completely overdetermined. So if you try to fix the schools, you've got 5 of the risk factors that overpredict the outcome. And you know what's exciting about Promise Zones, of course, is it's trying to move beyond that model and be multi-sector. The other thing that's really interesting about this generation of poor folk in America is that, unlike any other generation, many of them have been exposed to intergenerational poverty and to intergenerational disadvantage on the neighborhood level. So there's really interesting work by Pat Sharkey showing that, who's at NYU, showing that where your parents grew up has a direct and an indirect effect on your outcomes. Probably the pathway is trauma, which affects parenting, but we don't really know. But these kids are so overloaded with risk factors, both multi-sector and intergenerationally. Talk to me about how you think about that. Now, I love that you all were saying about it making a generational investment, not just a 5-year investment, but how do you think about the deep challenge that you see now that we wouldn't frankly have faced if we were doing this 40 years ago?
I'll try and tie that to some of the failures, and I wanted to build on this right off the start, that our failure, I'll speak about West Oakland, you were saying West Philly, to really understand the displacement that has been going on and to get ahead of that has been a notable failure, not just of our organization, but of leadership in the community most broadly. I mentioned another one earlier, which is that an inadequate amount of what we've been calling reach, intensity, and duration of our interventions, sort of 2, 3, 4-year efforts, and their failure to actually change behavior change, has been a really important learning. And yet we see a lot of organizations out there still making 18, 24, 36-month grants. And I think there's, it's fine, it's good, it's the right stuff, but as they say, it's directionally correct, but unless you see it through for a longer period of time, and you can't just do it by, well, we're going to do a corner store conversion here, and we're going to use green lanes in over here, or this house. I mean, of course, each of those add up, but until we have an opportunity infrastructure that really addresses potentiation in its most full way, we should not pretend that it's going to happen. I mean, I don't know if we want to go down this. Many of us are relative privilege, right? And our kids are growing up in relative privilege. We do everything we can, and it doesn't guarantee a darn thing, but at least it gives a shot, right? And yet we think these little things we do in so many communities are going to add up to an opportunity. It doesn't add up. It's inadequate. And so I think we have to have a holistic, longer-term view, and anything less than that. And on this adverse child experience, since our organization did some of the early research on adverse child experience and what it means for long-term potentiation, I just want to say that we've often said that the 30% of what creates health that has to do with our genetic inheritance, it just is what it is. It's not what it is. It's happening right now. An adverse child experience is changing genetic expression so that the children of those children are going to be impacted by the traumas. That's actually happening biologically. So we have all these economic and educational and place issues. It's happening at the genetic level at the same time. We have got to actually make that commitment now and all the way through. That's really what it's going to take, or we're not going to get at the equity inclusion themes.
So telling yourself the truth is really important.
Absolutely.
When you're dealing with tough issues. You have to be able to make the kind of commitments that are authentic responses to the problem. John?
So a large part of our effort is kind of focused on this cradle to career strategy. So we're working in 18 daycare centers. We have involvement in this new pre-K through 8 school that we're standing up and getting ready to actually build. We're working in all the local public schools in the Promise Zone. And we're struggling on how to sort of work through the high school piece. We haven't gotten to that yet. It's complicated. And then we have summer enrichment. We have the extension center where we have side-by-side cooking classes with our students and millennials from the neighborhood, and they do things together. We're starting to bridge some of those gaps. So that's sort of how we fashioned it. And I think, again, most of our effort and our investment has been sort of in the early part of that pipeline right now, and we just feel like there's just not enough of an educational infrastructure in this area, and unless we step in and start to sort of stimulate that. And the foundations here have been incredibly good to us. William Penn and Lenfest in particular have really supported us, and Middleton's, and it's been helpful to like I said before, put in place these pieces of infrastructure and try to tie them together so that little kids in this Promise Zone get a good start, and obviously they need all sorts of supports along the way. But we have something called the Liberty Scholars. We give 50 full rides to Drexel every year for Philadelphia kids. And the goal is someone who starts in one of these little pre-K programs and becomes a Liberty Scholar, and then one day has a shot at a great job at Schuylkill Yards. And it's a small group, but at least it's an effort to connect all this potential opportunity to people in the neighborhood who right now don't have much of a shot at those kind of opportunities.
So you're also thinking holistically and about the life course.
Right.
Connecting all of the pieces across the life course. So I've been getting to ask all the questions, and I want to open it up to the audience for questions.
Hi, thank you guys so much. This has been great. I'm Nick Ashburn. I'm with the Wharton Social Impact Initiative at the University of Pennsylvania. And coming back to what you guys discussed around this being a long-term strategy, as leaders of or within your organizations, how are you making these principles permeate throughout the organization, and how do you institutionalize that throughout the corporate or organizational culture, especially if it outlives you or your positions?
So, I mean, for a university, at least, there are sort of two self-perpetuating bodies. There are faculties and there are trustees. And so the way we've constructed our strategy, which is a little bit different from what we did at Penn, is that our faculty play an absolutely central role in all of these activities, not just the students and not the administration, but the faculty are sort of front and center. At the same time, I mentioned before, we have a sort of governance structure at the trustee level that incorporates what we call neighborhood partnerships. So, and I'm going to do my best to tie the hands of my successor for as long as she or he is president after I go. But that's only a finite period of time. So the idea is that during this period of time, with faculty leadership, with trustee leadership, which becomes part of their culture, that there can't be a sort of an abrupt change and someone comes in one day and says, I'm not interested in neighborhood partnerships, I don't care about Promise Zones anymore. It won't happen because the faculty themselves will be so deeply committed. The trustees will almost consider it a fiduciary responsibility. And so, yes, in 20 or 30 years, if that job gets done right, it really becomes part of the mission and the fabric and the culture of the place. And again, administrations come and go, but the administrations that come in the future will walk into a situation where they realize that this is sort of a profound missional commitment. And to some degree, their hands are tied, and so be it then.
It's the key question because it's not that easy. Our mission is to provide high quality, affordable care and to improve the health of communities we serve. So our move to start with is to move from one of contribution to accountability. And that's a pretty significant piece from, oh, well, we're doing good things to we're on the line, like my daughter was saying, for improving the health and lowering healthcare costs. And that is really the first conversation. Inside our organization, starting with our CEO, the leadership team in the organization, every single of one of our 7 regions and every single one of our major national functions is on the line to talk about what the anchor strategy looks like internally. So our buy-to-pay supply chain has targets around localizing our spend. And we've been making the hard choices to say that, some things that are more green, localized, might cost more, and we're trying to keep costs down. So we're figuring out the incentives in that. Our HR senior vice presidents, our IT, literally every single unit in the organization is on the line with goals and strategies, and we're building a culture that says that's actually a priority for us. So it was one of the reasons I ended up on a red eye last night is we were in an all-day meeting with 150 top executives that what will our anchor strategy look like? Not because it's the CEO or, oh yeah, that's the anchor institution guy. They'll do that, but actually making it a social movement inside our organization where there's a distributed leadership model that everybody's on the line to actually drive that. So it's a big part of it. And then secondly, to recognize that we're going to need to partner with our competitors and others to actually be able to deliver the outcomes in our communities, because regardless of our size by ourselves, we can't do it and shouldn't do it. So it's, please.
No, I was going to say, and one small thing, I think the way you set this up financially so that it's actually self-sustaining, there are restricted funds, there's strong philanthropic support, it's not going to be the kind of situation where it would be easy to untangle, because you've set it up almost as an independent responsibility center that has enough sources of income to sort of keep it going. And so when you get to that issue of sustainability, it can't be viewed as this is a burden of overhead, but this is actually something that is very special and privileged and has the resources to do its best work. I'm sorry.
I know, I love that. It's perfect. And for us, it would come back to the same thing around our affordability strategy. We need to do this to improve health and to be able to lower care costs over time, because our mission is to not to be more affordable than the other guys, but to be affordable so that people can actually afford their health care.
So I just wanted
Sorry.
to,
yeah.
I think we've
Pardon.
got her next, but I just wanted to be provocative and suggest that you might want to take a page out of John's playbook and have community picnics. See how that goes.
Yes.
So go right
That's
ahead.
Great. Yeah.
Hello, I'm Nancy Lee. I'm with Interrise, and we're a nonprofit that supports small business owners in low and moderate income communities achieve next stage growth. And we believe that contracting with anchor institutions is an organic way for these businesses to grow. So I'm curious to hear, what are some of the challenges that you're facing with working with local small businesses in your procurement?
I know for us, one of them is just that as a large organization with a pretty high volume of purchasing and standards around that a lot of smaller companies that are just getting going, there's no way they can really meet some of the standards. So we've been having to say, what do we need to be doing to help them build the capacity? So our partnership with ICIC and others have really been about actually investing directly in the capacity of those companies to be able to grow in a meaningful way, to be able to do that. The same thing has been true with nonprofits, that rather than historic grant relationships to moving into contracting relationships with them, which they don't like quite as much. It's a change, but what would it look like to actually move that? So we've been investing in the capacity building, the infrastructure development, the financial skills, the governance skills, and as part of helping grow our vendors, if we want to put it in that way, very, very deliberately.
We're sort of a step behind Tyler. We're struggling to figure out how to help these businesses build the capacity to sort of maybe keep up with some of the opportunities that we can provide them. We're working with one construction company right now that we've really given a lot of business to, and we're finding that they're having a hard time sort of doing the things that we've asked them to do, and then also they have a whole other book of business, and they seem to be really struggling, and then we in turn are struggling to figure out, well, what are we supposed to do to help them? And I actually don't have that kind of expertise, so I'm trying to figure out how do I get some of that capacity building so we can, help them get to the next stage of growth, because they're a really good small company that wants to become a really good mid-sized company, and we've given them the opportunity, but they're struggling, understandably, underneath the burden of some of this new volume that they're dealing with.
What would you tell us that we're not saying?
No, I think you are saying it, and I guess maybe a follow-up to what are some of the challenges is what are you doing to address it? And you're both are saying capacity building, and so in my research at Enterprise, this is what I'm finding is that there's this mismatch between the local small businesses and the anchor institutions, in that sometimes the small businesses need this capacity building, and anchor institutions have, maybe from their past experience, had this belief that all small businesses are too small to provide the quantity, quality, or the speciality in what they need. But that may not be the case. And so what we're trying to do at Enterprise is to kind of uncover this and have conversations around this and get the small businesses and the anchors in the same room together so that they can talk to each other and realize that maybe some of those challenges don't exist or they're much smaller than they think.
Yeah, great. We've got a question over here.
Hi, I'm Harold Simon from Shelter Force Magazine.
It's wonderful, Harold.
So I have a question that mostly to Tyler Norris, and this is maybe a third rail kind of question, but so you're working at the upstream social determinants of health and organizations that are trying to change those things and have been trying for many, many years. But that's not the top of the stream. The top of the stream is public policy and what goes on in other corporate boardrooms, the decisions that are made there, who maybe aren't enlightened like Kaiser or maybe are just indifferent. So what kind of policy work and with what kind of work do you do to influence that beginning of the stream to change some public policies?
I'll try and respond briefly. I'll say this as an organization that it's hard as a clinical organization trying to provide high quality care, that we don't suggest what others should do until we're doing it and have demonstrated it. So the same kind, and you're asking a great question, so the same kind of thing, until we've improved the health of our own workforce, we're a little slow to start telling our customers what they ought to be doing. And the same thing is true for us with our anchor strategies. Until we've really localized our spend, we're building differently, we're using green energy, we've kind of changed our own policies and practices. We've been a little slow at actually trying to change policy. And yet I think to talk about sugar-sweetened beverage, making our farm bill healthier, the Surface Transportation Act that provides for walking and biking infrastructure. I think we're increasingly testifying and speaking about the health impacts of those, and then trying to kind of be our own proof point enough to be able to demonstrate what we're doing rather than push.
Last question.
Hi, my name is Stacy Lindau. I'm a physician scientist at the University of Chicago. I just wanted to comment quickly on the question about, the really excellent question about how your organizations are thinking about working with small businesses and the idea of the innovation corridor you talked about. At the University of Chicago, we're a place of theory historically, but very recently we created our first incubator for small businesses. So we're starting to see that faculty are spinning out businesses, and I, by virtue of a Healthcare Innovation Award from the Centers for Medicare and Medicaid, found myself in this position, creating a new startup, basing it in the community because that's where the idea was formed, and now looking to find customers. The medical center, the university might be a really great customer. So as we start to innovate and we engage our faculties at the front line of the work, where the ideas, the solutions we're engineering to solve local problems, we have to think about how can we support small for-profit and not-for-profit enterprises that are being led by our faculty, and we have conflicts to manage around that. So that's been a really interesting aspect of our experience. On the question side, I'm interested in the community health needs assessments that are now not tax-exempt. Hospitals obviously have to assess the needs of the health of the community. And it seems to me that there's opportunity for collaboration across competitors, especially in concentrated cities, to really to contribute collectively to data collection that would not only address our tax-exempt needs, but would produce a regular stream of data about the health, broadly speaking, of the populations we serve. And so I'm wondering whether either of your organizations is thinking about the needs assessment requirement as an opportunity in this way that would stimulate science and public health, beyond just meeting our regulatory requirements. Thank you.
So, start with that. Absolutely. And in fact, I think you're talking about an ongoing data infrastructure, including with community source data that needs to be part of that, not just in the rearview mirror data that needs to be part of that. Our investment in the Community Commons, communitycommons.org, is a way of actually building a platform between providers in order to be able to do this work together. So I think it's a really key piece. And I would ask those of you in the finance world, how can what we're discovering in our community health needs assessment be lined up against Community Reinvestment Act requirements, so that we're starting to look at our financial institutions and our community benefit and CRA requirements together. But you're making a really important point about a data infrastructure. And we are doing that with our competitors increasingly. Yeah.
The only thing I would add, and just a local story, is that we were lucky enough to receive a significant gift recently to name our School of Public Health, but the bulk of the gift is for something called the Urban Health Observatory, which is basically designed to do just this. Now, if my dean was here, she could explain all about the particulars, but this is essentially the idea. It becomes a commons for people to sort of, share all this information, and the person who's actually doing the needs assessment right now in the Promise Zone neighborhoods actually has a joint appointment in nursing and public health. We actually recruited her from Penn. She's an amazing person. So we're starting to build capacity there as well.
Teresa.
I want to ask you all to join me in thanking this amazing panel, Kathy, John, and Tyler. So this panel and this discussion exceeded my expectations. I want to just very briefly tell you that if you have downloaded the app, Tyler was generous enough to connect us with some resources on these critical issues that he's discussed. And so if you go to his bio page, you'll be able to access those resources. Additionally, we'll be adding some resources around the work that Drexel University is doing in the West Philadelphia neighborhood. I also want to give a quick plug. John mentioned the amazing work that Drexel is doing at the Dornsife Center, and there was a very robust conversation about community engagement and resident engagement. Tomorrow morning, we will be hosting a learning lab at the Dornsife Center, where we will highlight best practices from around the country in promoting resident engagement. We'll run through a series of exercises, and you'll be able to ask some questions and learn kind of best practices from some of these fantastic and humble people that John has over there working on these critical issues. If you're interested, we have a couple of seats available. Please go to the information desk, the registration desk, and they'd be happy to sign you up for that tomorrow morning. Lastly, or leading to my last point, Kathy's book, $2 a Day, is on the desk of almost every person in my department, and so we have made it available along with Coming of Age, the newer book, and so there is a bookseller out in the hallway, and you'll be directed there if you're interested in purchasing this book and these books and others. You can do so outside of these doors. And lastly, I hope that you all will join us for a brief reception across the hallways in the Columbus ballrooms. We've had a fantastic day of conversation in these structured environments, and so we really want to network and get to know you all a little bit better. So please join us directly across the hall. Staff will direct you. Thank you so much for your attention today, and we're looking forward to tomorrow.